Friends, I'm Dr. Sanjay from the Kokilabin Dhirubhai Ambani Hospital in Mumbai. I must speak to you on kidney stones, a common and a ubiquitous problem which men suffer from, women suffer from, all age groups suffer from, and sadly, majority of them present with an emergency. So if you have a kidney stone, there are only two natural histories. The stone would gradually get bigger, and could become a big stone. When you wake up to the phenomena, it may be painless completely. On the other side, the small stone can fall down the ureter or the kidney pipe and give you a discomfort, which is called as ureteric colic. The stone falling down, giving you a pain on one side suddenly at night, is sadly an emergency on which you sat on a kidney stone knowing there was a kidney stone. There are a few important aspects and myths we need to shatter. Number one is, once a stone former, always a stone former. That means if you form stone, the tendency to form stones is common internally, and we need to be aware that the stones can form again and again. So you come to me at the Kokilaben hospital in an emergency. You have a stone blocking the kidney pipe. I take a ureteroscope, laser, and clear the stone completely. You're done and dusted and you're cleared. You're cured of a disease which actually troubled you and gave you an emergency. But. That's not the last stone you would have. You may have a stone again and again and again. And therefore, there's a wake-up call completely in terms of preventing a stone. And how do you prevent a stone? Remember that stone formation broadly for a common man across the table is all about supersaturated urine, where the dissolution of all the solutes within the liquid that is given as a urine may not be happening. So supersaturated urine would allow to nucleate, aggregate, crystallize and form stones. What are we supposed to do? We're supposed to improve our water intake dramatically. And how do you do that? You improve your water intake when you get up in the morning, a glass or two of water. Before your breakfast, before your lunch, before your dinner and before you go to sleep, a good amount of water. How does it help? It dilutes your urine to a level from where anything and everything can be dissolved. Number one. Number two, it's important to know that lemon and orange are good stuff, including the avla, because lemon, orange and avla have got high degree of citrate. And citrate prevents calcium oxalate from joining and marrying in the urinary environment. They can't join, they can't marry, they get dissolved and come out. That happens for 50 to 70% of individuals in the city of Mumbai. Friends, seeds that you eat don't form stones. So lady's finger, guava, papayas, and all those things that have got seeds and you eat, including tomato, don't form stones. So don't live in that myth that you would eat something and stones would form. Remember, everybody on the dining table eats the same food. Then why should you form stones and others don't? It is the environment in the body. It's the metabolic aspect that changes in the body looks into it. Therefore, if you have a kidney stone, don't sit on it. Today, there is this surgery called as RIRS. We take a telescope, enter your body, go powder, plug the stone and clear it off. Flexible ureteroscopy, laser, lithotripsy, and the stone is cleared. So let's not wait for the stones to fall, create a trouble, become big, and then we'll end up with the major surgeries. Friends, stone formation is ubiquitous. We've got to work hard to prevent stones and get treated of all the stones that you have. Wish you good luck.